What do you expect from the Vesalio in 2006?
Well,
26?
to be honest with you, Serdar, I expect to continue to have very good results with the NeVa, and particularly the NeVa NET. You know, in an earlier publication that Vladimir Kalusek and I collaborated on, we showed that in the first 20 cases, we had first pass TICI-2C3 in north of 90%. So I know that, you know, the large bore, super bore aspiration catheters are coming, but so far, the results that I've seen with NeVa NET, at least for ICA and M1 occlusions, haven't they're not matched by what I'm experiencing, and I know that you've got really good results. So
So
you've
you
used it a
say
lot
that
as well.
you're expecting easy, user-friendly device to use. And when you're saying that, I was thinking of, is this the device successful or the operator successful?
Well, you know,
Or the both?
I think it's both, right? You have to know how to use the device, as we've discussed before, and certainly good training and good experience and high volume. All of these things, all of these things matter.
That I was trying to point out. This device is a little bit different than the others. So it has to be understand well to
Yes.
use it in the proper way. And then we are happy, like you said, we are happy with the ICAs, for example, which are prone to not to have first pass TICI 3s, 2Cs in the beginning, in the first pass. But with this device, we can easily have, I mean, our cohort has more than 60% first pass rate for the internal carotid artery occlusions, and then we will provide in multi-center retrospective cohort to analyze this as well. But you have more experience with the net.
Yeah. I have to say the 4x30 NeVa NET has become my workhorse stent retriever for ICA M1s and maybe even M1-2 occlusions, but only, I would say, if I can get the device into the angular or the, you know, the main trunk. I don't really use the device going into the ascending frontal artery complex, because I think that's when you can start having problems.
And what do you think about the 3mm device? That's our major expectation in 26, right?
Yeah, so I think both you and I have been saying to the team at Vesalio, can we have a smaller device? Can we have a smaller device? So yeah, so I fully agree. I think you know, it's always useful to have a nice range of devices, because you don't quite know what you're gonna face often, you know, and every patient is different. There's vessel size and things like this, and even if, for example, you have the net and you get very good first pass rates, if you have a Y-shaped clot, for example, sometimes you might still end up having a small distal occlusion, and then being able to pick up a smaller NeVa to go after that. It'll be very nice for me anyway. And just to double check, I think that's capable. I think that's going to pass through a 17 microcatheter as well. But we'll have to check that with the company.
It's passing through 17 catheter. And then the company faces changing from thrombectomy, metallic thrombectomy company to bringing up aspiration catheters as well. And then in vitro testing it's very promising. What do you think about that one?
I think again, you know, if you're in this space, if you're in the thrombectomy space, whether it's in the, you know, whether it's neurothrombectomy, whether it's thrombectomy now being developed in the heart or in the body, PE, DVT, etc., I think you have to have the full range of equipment, really.
If we can combine together, maybe we can increase our first pass rates up to the levels that we want to have it in our hands. That's my major expectation from Vesalio.
Yeah, I think that's a very reasonable expectation to have, and I think the team are certainly working towards that, right? So that's cool.
Yeah.
Anyway, Serdar, it's been a pleasure having you in the Brain Fireside living room, and I hope that you get nice and warm and enjoy a mince pie.
Yeah, it's our pleasure.
Yeah, thank you very much.
Thank you.